Today, I am talking to you guys about caring for someone with lupus, and I want to thank you guys for spending your Saturday learning more about lupus uh, and hopefully taking away a few pearls. Really had some great speakers. I've been on all morning, and I was able to hear Dr. Foster, and I was able to hear Gretchen, and then my colleague Arnita, and I just heard Tori finish up. So a lot of good information has been shared today, and I'm excited about that. I didn't turn on my video. I don't know. I can do both. It looks like I was able to do that now. And so I will start before I get started. This is presented by GSK in our Us and Lupus program. And this presentation does not take the place of a doctor's visit, a doctor's advice, and for any health conditions that you have concerns or treatment, please refer back to your physician for that. And with that being said, we'll just go ahead and get started. I'll let you know that my goal today is to help educate you, your family, your friends, loved ones, your partners uh, about living with a lupus warrior and some of the challenges you may face and different ways that you can better support your lupus warrior. Uh, so keep that in mind. This is really for the caregivers. So as I get started, if you're a lupus warrior, you have someone in the house that's not joining you right now, holler at them and try to motion them into the room, and hopefully they'll sit with you for the next 30 or 40 minutes so that maybe they can pick up a pearl or two that will be helpful to supporting you. So we're going to cover 5 areas today, talking about educating yourself about lupus, helping manage the lupus lifestyle, communicating with your loved ones, understanding the lupus healthcare team, and caring for yourself. These are 5 different areas that are very important to people living with lupus. And we'll have a little break at the end to do some questions and answers. We know first that we want each of our caregivers to understand how very important it is that you're here. Thank you for showing up. The first step in helping your loved one who is living with lupus is educating yourself about lupus. And then we're also going to give some pearls about how you can help take care of yourself in the wake of living, helping you be supportive of your one lupus warrior. There are so many different chronic diseases out there. Lupus is just one of the many chronic diseases. The broad definition says that a chronic disease requires ongoing medical attention and it limits a person's ability. Usually, a chronic disease goes on for more than 3 months too. When we talk, lasts for 3 months or longer. And many of these illnesses can't be cured, but they can be controlled. And a word that we often use is the disease can go into remission. And Tori just bore witness just before I spoke about the disease being able to go into remission. And we do know that getting it there is a lot of work and takes a lot of sacrifices and changing in your lifestyle. In fact, 6 out of 10 adults in the United States have a chronic disease, and with 4 out of 10 adults having 2 or more chronic diseases, the most common chronic diseases, as we see lupus a lot, but usually chronic diseases we see more often are cancer, heart disease, diabetes, a stroke, and arthritis, which sometimes we know is lupus gets that misdiagnosis of. Since lupus is considered a chronic disease, there are long-term effects that can cause pain and inflammation in the body. Lupus can affect multiple areas of the body, either at one time or one disease area at a particular time. We know that lupus can't be cured, but it can be controlled, or it can go into remission. And we'll talk about different ways to better manage your lupus as we go forward. One characteristic of lupus is that it affects women 9 times out of 10. And we do know, as we've talked about before, when it does affect men are usually hit with it more severely. One of the things that we know for sure is lupus is a very unpredictable disease. Some days lupus warriors have few to no symptoms at all, and then another day they may feel like they can't even get out of bed because they're having a flare or something has triggered their disease that makes it just impossible to go through their daily routine. Symptoms of lupus can appear in different parts of the body. We know that it can affect your organs where it's visibly affecting them, or internally where it's not so visible. But these symptoms can affect one part of your body at a time, or it can attack you in several parts of your body being affected by it. You'll see a quote here from one of our lupus warriors who visited our Facebook web community and left a comment. And every day, this person said, every day with lupus is unpredictable. And we know that this is a fingerprint disease and it is unpredictable. You really need to know how you're feeling from one day, or don't know how you're going to feel from one day to the next. The stories that are shared on the Us and Lupus website are stories from loved ones and lupus warriors. And sometimes they're encouraging stories, or they're a validation story that helps you confirm some of the things that you're experiencing. There are lupus symptoms that appear on the outside of her body, like the butterfly rash that Tori spoke of just a few moments ago, that the nurse was able to look at her and know in the hospital from her experience that she had lupus even before she received that official diagnosis from her physician. But that's one of the outward symptoms that we see. Inside the body, lupus warriors can experience symptoms such as pain in their joints or fatigue, fever, sensitivity to the sun, and even more serious symptoms like inflammation that's going on around the kidneys or the heart, or inflammation around the lungs. And sometimes it even affects our blood and causes us to have lupus warriors to have blood disorders. Many of those living with lupus have heard this before. People say all the time, you don't look sick. Well, I have, if you've heard me speak before, I have another comment that I like to make, but I'll hold that one today and just say it's so important to know that you may not look sick, but we realize if you're living with lupus, you are sick. And so it's important to help our loved ones communicate about how their lupus symptoms are affecting them and how they're feeling. We can't always go by the way someone is just looking for that day. Another comment from our Us and Lupus website was made that lupus is definitely an invisible disease, and through it all, we have to keep pushing through. These comments like this help remind us that our loved ones living with lupus are warriors, and that they are fighting every day to keep their symptoms at bay. No one is alone. Remember that no one is alone in the fight, and we as caregivers can remind our loved ones that they are not alone. So I want to stop here just for a moment and ask this question, and you can, we won't come off of mute, but I'll just ask you to take a second to answer to yourself. How long has your loved one been living with lupus? And when did they receive the diagnosis? And when they received that diagnosis, how long was that process? I know Tracy talked earlier about the 6-year average. So whether your loved one has been living with lupus for a long time or just recently diagnosed, it's important to know that lupus symptoms can cause severe damage in the body if they're left untreated. So it's so important to follow the treatment plan, follow up on your physician's appointments, and get the care that you need. We know that lupus is an autoimmune disease, meaning that the immune system responds in a way that it mistakes our own healthy cells and tissues to be a foreign invader, such as an infection or something that shouldn't be there. This response causes inflammation in the body, and most of the signs and symptoms of active lupus are a result of inflammation in various organs in the body. For instance, when lupus causes inflammation in the kidneys, it's called lupus nephritis. Or if it can cause also tissue damage in other organs. And all this can cause complications of permanent damage in part of your body, like when we have lupus fog in the brain, or you have shortness of breath when it's affecting your lungs, or you have chest pain. So we're going to move from just talking about educating yourself with lupus, but on to talking about the symptoms that you have with lupus and triggers that you have with it. And as you know, your loved one has gone through a lot. The appointments that they have gone through, the discussions that they have with doctors, the different tests that they have run just to reach that diagnosis of systemic lupus erythematosus. Their lifestyles have probably been impacted in ways that sometimes you don't even recognize. And then we don't even factor in a lot of times the physical toll that it takes on them, along with the mental impact and the changes in their lifestyle that lupus is called. So it's one important part of managing lupus is keeping track of the symptoms and understanding the triggers so that they can talk about it, know what the triggers are, and try to avoid them as much as possible. To track symptoms, you can help your loved ones by starting real simple. And one of the simple ways that you can do that is encourage them to have a health journal. And you can keep appointments and treatments in that journal and keep things organized and scheduled for them. And when it comes to tracking symptoms, you can use a health journal also to make, it can make a big difference in bringing information to your physician and being able to share with them what their experience has been. You want to make note of the symptoms. Find a way, time each day or at least once a week to sit down with your loved one with lupus and discuss what's going on with their lupus. You know, what symptoms they've experienced for that week or that particular day, and make sure that you have notes for it in that health journal. And some of the things that we often neglect to address is their emotional and their mental state, how they're feeling, how's it impacting them. We need to make sure that we're addressing that so we can discuss that, one, amongst the family, but also with their physician also. Symptom tracking over time can help the healthcare team identify symptoms and patterns with those symptoms. And it helps us better understand what your loved one is experiencing with their lupus, how it's impacting them. And then also how they can personalize the care that they need and manage, you know, what treatments that the physician is recommending. So when you're tracking their symptoms, please remember that every symptom matters. So often you get comfortable with, or just not, I wouldn't say get comfortable, but learn to live with certain symptoms, but every symptom matters. So you want to make sure you're talking about it early on, making sure that if lupus is active, that you know that you're documenting the symptoms so the physician can help identify the impact that's had on you. It's so important to be proactive and to make note of how lupus is impacting the body. And as you can see, there are physical symptoms and invisible symptoms that can mean lupus is active. And when your loved one experiences any of these, help them to make notes and to keep track of the severity of the symptoms. And when we talk about severity, how long has it lasted? How often does it occur? And how is it impacting their life on a daily basis? Remember, every lupus experience is unique to the individual. So it's unique to your lupus warrior. The severity, the impact, and the timing of any of these symptoms can vary. So it's so important to recognize those symptoms and to make sure we're documenting them so that we can share them with the healthcare provider. One Us in Lupus visitor left some really strong words of advice. And the words was, know your triggers. Know your triggers, educate yourself, educate your family, educate your friends. And she gave a particular shout out to her husband. And she said, her husband who has supported her through it all. As a caregiver, it's so important to let your loved ones know that they can rely on you and that you appreciate the support that they're giving. A trigger is something that causes lupus to become active in the body. Another word that we use for a trigger is a flare. So we kind of use those two words interchangeably, whether we're talking about trigger or flare, we're talking about active disease in your body. So common triggers include stress is a huge trigger. And that stress can be physical stress on your body, something you're doing strenuous, or even emotional stress. And then as Tori talked about before I spoke, she talked about the impact of your diet. And when we talk about diet, the real word we should use is the impact of the nutrition that you're getting, whether you're fueling your body or what you're causing is inflammation from some of the things that you're eating. Remember, you got to think about the impact of the sun. Do you have a sun sensitivity? What's the impact of sleep? All these are triggers. Are you getting enough sleep? What are the medications doing? Are you having an illness outside of living with your lupus that's triggered? Is it a cold or a virus that you picked up? Something like COVID, something very important for everyone with lupus to avoid. And then have you had any kind of injury that may trigger a flare? All of these are important factors, and noticing these factors and the effect it has on your body is important to document and to report to your physician. We know that everyone experiences stress, whether it's, again, a physical or an emotional stress. Sometimes an emotional stress can be a stress trigger that causes you to have a flare. And you can help your loved ones manage stress in several ways. One is just simply by lending a listening ear and have them talk through whatever problems or concerns that they're having with you. Help them to maintain a reasonable schedule between work and school and even social events or any outings that you may have as far as planning family outings. You got to help them manage that schedule so they don't overwhelm themselves. And give them a hand also with things such as running errands, going to pick up medications that they might need, even cleaning up around the house. Sometimes they need help with that. Just the little things that you do sometimes can help reduce that stress. And you can also get together to do a relaxation practice, just like Arnita did earlier before I spoke. She talked about mindfulness and relaxation and just taking the time. Sometimes it may be to just deep breathe for a minute or close your eyes for 5 minutes. All these are mindfulness techniques that may help your loved one to de-stress also. Some foods can be a trigger for a lupus flare. You probably heard some lupus warriors say they have a reaction to alfalfa and the ingredients in that. Some people say that they stay away from garlic, others say they eat garlic, but you have to know what your triggers are and know whether you need to stay away from it. To better understand any food-related triggers, it's important to maintain a balanced diet and to keep track of your meals and even your snacks also. You want to help your loved ones to stay on track by helping them plan their meals and plan their snacks ahead of time. And then if you have those planned meals, when it's time to go grocery shopping, you can kind of stay on track more and not pick up items at the grocery store that may not be healthy for them. And making sure also by planning meals, you're getting the right number of calories in on a daily basis. And making sure that you have a variety of foods that are healthy foods for you. I know, just as Tori said, she said her brother can eat the same thing 5 or 7 days a week, every day. Some people can't do that. Lack of variety in the diet. They need variety, and as a result of that, you got to plan ahead to make sure you're doing that. You can check with your doctor too to understand the best nutritional plan for your lupus warrior. So many lupus warriors develop a sensitivity to ultraviolet rays, and that can either be the sunlight or it can be fluorescent lights that are inside, indoor light bulbs. And you want to make sure you're protecting yourself if you know you have that sensitivity to prevent a flare. Ultraviolet rays are stronger as far as sunlight is concerned between 10 a.m. and 4 p.m. So you want to make sure that you're dressing appropriately when you go outside to protect yourself from that. Using sunscreen is very important. You want to make sure you apply it every day if you're going to be outside in those peak times. And also making sure that you're dressed with sun-sensitive clothing. Remember too that if you're doing something, an activity outside, and you're going to be out there for a while, or even if you're doing something such as swimming or an activity that causes you to sweat, you need to remember to reapply the sunscreen. And again, have sun smart clothing on, including a floppy hat if you have one available and you're going to be out in the sun, and clothes that are resistant to the sunlight. Now we know that oftentimes lupus patients have a challenge when it comes to sleep. It can be a struggle for many people, but a lack of sleep can trigger symptoms. It can trigger a flare. And when those symptoms start, the pain and stress can keep you up at night. So you want to break the cycle and help your loved ones to get enough sleep. There are ways that you can do that. You can try to help them plan naps. They may need to take a 30 or 60-minute nap in the middle of the day, and encourage them to take any active role in managing their pain and stress that can keep them up at night. Doing this can help them to fall asleep by taking that nap earlier in the day, fall asleep and stay asleep at night. So again, we'll take a pause and just have you think, are you documenting all of your triggers, and what are you doing to help your loved ones to manage those triggers and avoid that lupus flare? Communication with a healthcare team is critical. You can help your loved ones in many ways when it comes to the communication with them. And we're going to take a little bit of time to look at ways that we can do that. Some parts of life with lupus are just hard to talk about. Everyone communicates differently. But when it's time to talk about a tough topic, there are some simple ways to get started. So first, you want to make sure that your loved one is in a comfortable setting, whether that comfortable setting is at home or in their favorite easy chair in a quiet environment, but make sure they're in a comfortable setting so that they are willing to open up and feel that it's a safe place to do so. You can start by saying, you'd like to talk about lupus and how it's impacting your life, and just ask them, is it a good time to talk about it? Because we want to make sure that they're comfortable with having that conversation where you're trying to hold the conversation. So I have a few examples here of ways to get started with these conversations. You want to share your wishes. You might want to open up by saying you want to be able to enjoy the outdoors with them again, or enjoy an activity that you've done together, and ask them, how can you help to be able to get back to this. Also, you want to say that you've noticed if there's something happened, you can draw in a recent situation that you know this treatment seems to have some kind of frustrating side effect, or you notice now that you've taken the medication, the impact that it has. These are all lead-in questions or lead-ins that you can use, that you can build upon the information you already have to get to the details that you may need to get to for your loved one. Scheduling talks. Many talks may come up naturally, like before or after an appointment, something the doctor said, or during or after a flare, when your loved ones looks like they're ready to talk, or they're exhausted or frustrated about something that's going on. That might be a good opportunity for you to lead in with a question. And you can also ask if you'd like to plan regular times to have talks with them, and see if you can agree upon a scheduling of time together to make sure that you're able to talk. And at that time, you can voice those concerns and questions and encourage them to voice any that they're having. And it's a good time to take notes. You're taking notes for what you learned during that time period, and notes for when you see the physician on the next appointment with your lupus warrior, making sure that you're able to address any concerns that they have. So you want to stay proactive about reaching out to your lupus warrior, and let them know that the line of communication is open. And if you can't be with your lupus warrior on an appointment, you want to make sure that you are reaching out to communicate. One, you can reach out to them via telephone. If you got video chat or FaceTime, you can reach out to them, or even a text message. All these are different ways. If you are missing an opportunity to be with them, whether it be at an appointment or your scheduled time to talk, that alternative ways that you can reach out to them. You know, a lot of times we know that lupus patients are dealing with lupus fog, but we don't talk about it. So let's talk about ways to fight the fog. We know that that brain fog is real, and it's a cognitive dysfunction that's going on with them. And it's a common occurrence. It occurs 50 to 80% of the time with lupus patients. So we know that, as I said, it's something that they're dealing with and it's very real. And as we talk through communicating with your loved one, it's important to note that that brain fog can affect their ability to keep track of things, keep track of even the conversation that you currently have. Because sometimes they may pause and just lose their place or their train of thought. And a lot of times that's lupus fog. Now, some of us, it's just a gray hair showing up and a part of the aging process in life. But if you see that it's happening more than the common occurrence, that's something you want to make note of and find ways that you can help them fight through that lupus fog. It can know that it can also leave them feeling like unable to concentrate. It can be frustrating for them, and it can cause confusion. You can help fight the fog. Try to keep making notes during the conversation. If you have a point that you're trying to make, write down 1 or 2 keywords that'll bring you back to that point, or bring your lupus warrior back to that point. Make a list of items that you want to make sure that you just discuss with the physician, and make a list of questions. Also, all those things are good. And as conversations come to a close, recap, go over the goals that the physician wanted, that he has set down, and how you're going to accomplish those goals, and make sure everyone is on the same page. Brain fog is one of those things that makes many lupus warriors feel alone, and it also leaves them feeling misunderstood. By using the communication techniques that we just talked about today, you can help your loved one know that you understand what they're going through. As one of the visitors on the Us and Lupus website wrote, lupus can be a very lonely and isolating disease, and it can feel so good just to know that someone is educating themselves and trying to be supportive of some of the challenges they face with this disease. So let's talk a little bit about some of the communication tips that I just shared with you. As a caregiver for someone with lupus, you may be communicating alongside or on behalf of your loved one, your family members. You may have to communicate to their employers and even their healthcare professionals. Sometimes you may even be able, one that has to talk to the insurance company. So make sure that you're gathering all the information that you have. Make sure that you're being a good listener. And one of the things that I say, in addition to being a good listener, be a good observer, because sometimes they're not able to articulate, some of the things that they're feeling. But when you see that there's a change in them, be able to ask questions and articulate what the change is. There are a few tips to keep in mind. You want to first and foremost always be a good listener. Prepare for difficult subjects, okay, like finances or even side effects that they're having from different medications. And always remember, try to be patient and understanding of what your lupus warrior and others may be feeling. These are all key, and be sure to share openly about any concerns that you have, anything that's worrying you, or any needs that they have. So let's see. In addition, communicating with your loved one doesn't always have to be a conversation. I said be a good observer. And what I mean by that is you can help them by taking some time to learn more about the lupus disease and some of the symptoms that they're having, just like you're doing today, being here, learning a little bit more about how to help support them. And you want to offer to go with them to your doctor's appointments. If you're their lupus appointment buddy, make sure that you try to make it all those appointments and set up for them so that you can have a conversation or ask the questions that they may have forgotten. And one of the things too, as an appointment buddy, you may want to keep in mind is try to plan ahead, because A lot of lupus patients can't stand the cold. Just being in a cold environment, even if it's in an air-conditioned office, you might want to prepare ahead by bringing a throw, or if you know the seating is uncomfortable, bring a little pillow that may help be able to go in the small of their back. But all these things that you can do to plan ahead to try to make it a more comfortable visit for them. Yeah. So let's talk about health management and the healthcare team. So living with lupus and your loved ones likely have, they have many doctor's appointments. They have to talk about the symptoms, the treatments. They talk about the tests that's being run. And how many times are you talking? How many physicians are they seeing in a given week? That you have to repeat some of this information, but it's worthy of repeating to make sure that they get the care that they need. When you look at the lupus healthcare team, that team, as you see listed here, there's 12 people outside of yourself and your lupus warrior. So you have to keep in mind that's a lot of information to make sure that everyone is getting what they need for it. Who makes up a healthcare team? It's everyone who helps your loved one. So it doesn't just mean the doctors, because a lot of times we say the doctors, but it's everybody. It's the doctors, it's the neurologist, it's the dermatologist, the nephrologist, the general practitioner that they see, whether it's a physical therapist. They might even see a psychologist or a psychiatrist. Either one of them. All of these make up a part of their teams. And then when you think outside of the traditional, part of the people that make up the team, I know Tracy had a presenter last year on one of the Tuesday support group meetings, a dentist. And a lot of times we don't factor in the role a dentist plays in caring for a patient with lupus. But that team is a big team, and you want to be a strong partner with them, making sure you're sharing that information with them. Every healthcare team is different according to the symptoms that your lupus warrior is experiencing at a particular time. Every team is different, but there are a few tips that you can keep in mind to make sure the team is working together properly and everyone is getting the information that they need. So first you want to designate who is the team captain. Is the lupus warrior the team captain? Is a family member, the significant other the team captain? Or have you named the rheumatologist team captain, which the physician may not necessarily be the one that you want to put in that role, because they're not the one that's going to be at every appointment. You and your significant other may be the ones that are making your appointment buddy, making every appointment. The person could be your loved one or any of the physicians, but the main thing is you want to make sure that information is being transferred from one provider to the other, that everyone is getting the full picture of what's going on. You want to be sure to set up reminders for upcoming appointments, reminders for prescriptions to be refilled, and you want to follow up on any unanswered questions that your loved one has unanswered. If you join your loved one at an appointment first, you want to be sure to understand what role they'd like for you to play. Some general tips to keep in mind are including taking notes during the appointment, making sure you're taking into consideration how they're feeling, your lupus warrior. And so I'm talking about remembering important questions to ask, like giving the doctor insight into how the lupus is affecting the loved ones, helping your loved ones talk about their concerns, and addressing your own needs. Together as a team, you can help the physician set appropriate goals for your loved one, whether the appointment is in person or if it's a telehealth platform. The communication between you and your loved one, your doctor, is critical. So this is a survey that was conducted in 2015 that GSK asked over 200 patients, 100 caregivers, and 75 physicians. And basically the takeaway here is lupus patients may feel that they don't want to be a burden to the healthcare team and even to their loved ones. And as a result of that, 61% of patients said that they minimize their symptoms and they don't always report the severity of what's going on with them. Results like this show us that the importance of being there for our lupus loved ones to help them talk about their experiences, either their symptoms, how the lupus is impacting their daily life. Often lupus patients don't feel confident And but you can help them to take charge of managing their disease. Even the majority of physicians who were surveyed believe that their patients have trouble communicating their support needs to their loved ones. And so we want to make sure that they are comfortable doing that and sharing all that information. So I am going to skip forward a little bit because I see we're getting closer to time. I will talk about, as we continue to show support in managing a healthcare team, there are some tips I want to share with you. First, once you understand what role your loved one wants you to play during appointments, be sure the doctor also understands. This includes how involved you are at home or with the treatment schedule, and how you assist your loved ones in their daily life. You want to be honest and tell it like it is. Only you have seen how your loved one manages their disease when the doctor isn't there. You can gauge which goals are most suitable for your loved ones and which ones are not. So take some time to do a little bit of research. That way you can ask the right questions during the appointments and be appreciative of the healthcare team and understand some of the recommendations that have been made. So I'm going to finish up with about 3 or 4 more slides here. And what we're going to talk about finally is self-care and how important it is for you as the caregiver to take care of yourself. If you aren't taking care of yourself, you won't be able to be there for your loved one. So let's talk a little bit more about self-care. As a caregiver, you face your own stress. When your loved one has lupus, it can be discouraging to know that there is no cure. But some of your own stress can come from emotional, physical, and financial challenges that you may be up against. Sometimes you may feel the burden of being on call all the time. It's important for you to keep tabs on your own signs of stress. Anytime that you're having an illness and discomfort, you may experience a lack of sleep, fatigue, weight changes, and body aches. All these are signs of stress that you need to address. So we want to walk through some self-care and stressful management techniques. If you feel a personal barrier when it's time to practice self-care, ask yourself, what's standing in your way? Ask, do I feel it's selfish to put my needs first? Do I have trouble asking for help when I need help? As a caregiver, you shouldn't feel selfish. You have got to take care of yourself in order to be able to help take care of your lupus warrior. Don't forget that your health is a priority. To help manage your stress, you can schedule time to relax, take some time to do an activity just by yourself, and then ask for help if you need it. If you need a break, ask for help. If you need to step away for an hour a day, let it be known. Be sure to hold on to who you are. It's easier to get lost in being a caregiver, in that caregiver role. But you need to exercise, you need to relax, you need to take time away and understand what you can't control, and always maintain a good relationship with your healthcare team. So I'm going to stop here and let you take a second to do a self-evaluation of whether you're taking care of yourself as a healthcare. And if you are the lupus warrior on here, are you taking some time to yourself? Are you taking care of your mental health? Are you taking care of your physical health? When we talk about being proactive and being active, we're not talking about being physically fit, you're 18 and fine, but being realistic about the exercise that you can complete. One caregiver said, I have an amazing friend that maintains her lupus like a champion. I try to educate myself to know what she deals with. That mindset is exactly what we are here. Why we're here. I am so glad that each of you joined today to review these topics and to take the time to show your loved ones that you care about educating yourself about lupus. Our website, the usandlupus.com website, you can use your camera on your phone and hold up to either one of these QRC codes, and it'll take you right to what you want to learn. If you want to learn more about the caregiver, hold your phone up to that particular QRC code. Symptom tracking, the tracking kit, or the basics about lupus, any of those. So I'll leave that up there for a moment. And Tracy, I'm gonna kick it back to you and
All
see
right.
if you have any questions.